Hi, this is Nancy, the People's Nurse. So let's do a quick one. Let's talk about hepatitis B. How many of us knows that hepatitis B is not curable? How many of us know about hepatitis B? How many of us knows that it is a lifelong infection and can only be managed? So this hepatitis B is caused by a virus known as hepatitis B virus. Hepatitis B can either be acute, that is short term, or chronic, that is long term. Acute hepatitis B can be managed by lifestyle change, or should I say lifestyle modification. It can be managed by drinking fluids, water. It can be managed by rest. While chronic hepatitis B can be managed by a drug known as tenofovir, which is also one of the combinations of HIV drugs. How do you know that you have hepatitis B? You can only know that you have hepatitis B when you go for screening, when you go for lab investigations. There are signs that you might notice for a chronic hepatitis B. Yellowing of the eye or the body, tiredness, abdominal pain. For some people with acute hepatitis B do not present with any symptoms. Hepatitis B is transmittable just through the same process or the same route by which HIV is being transmitted: unprotected sexual intercourse, unscreened blood transfusion, sharing of sharp objects, anything that has to do with fluids from the human body, the semen, the saliva, the blood that is being transmitted through that route or routes. Prevention. Hepatitis B can be prevented through vaccination. Hepatitis B can be prevented through practicing safer sex. All pregnant mothers should be screened for hepatitis. In that way, the baby will not be infected because it can be transmitted from mother to child, just the same way HIV is being transmitted from mother to child. So I will advise you go for hepatitis screening, be it hepatitis A, hepatitis B, hepatitis C. Go for hepatitis screening. The earlier, the better. Complications of this chronic hepatitis is liver cancer, liver cirrhosis, even death. Because when the liver is cancerous, definitely death will occur. So please, let's make it a routine to go for checkup. Once in a while, go for screening. If you think you have been exposed to hepatitis, please go for tests. That's all I have to say. See you guys in my next video. I still remain Nancy, the People's Nurse. Bye.